Good morning, good afternoon, and good evening. It's the Village Radio here with a great announcement. In the Image of Christ, along with Florida Community Health Center, would like for you to join us each and every third Thursday of the month as we launch a brand new program called Ask the Doctor. Thank you for listening to WJGW, and we are here with the Ask the Doctor show, and it is time now to go into the questions that the callers are calling in, and our special invited guest from Florida Community Health Center.
Good morning, this is Dr. Charles Zolikoff. I am the Director of Women's Health at Florida Community Health Centers.
Okay.
Hi, I'm Rosanna. I am Miss Hazel's daughter. I'm filling in for her today because she is out of the country on a mission trip.
That's right. So what's our topic for today?
So our focus today will be on women's health, which will encompass, breast cancer awareness. We're going to talk about pap smears, all things to do with women's health. Okay. With Dr. Zolikoff here today. Okay, Dr. Zolikoff. So, yeah. Oh, that's my phone. Okay. That was me. Okay, I'm sorry. So, Dr. Z. Can I call you Dr. Z?
That's what everybody calls me.
Because what Rosanna just said, I'm not even going to make an attempt. No, I'm not going to do that. Not live on the air. Dr. Z is our specialist for today from the clinic, and this is his area, right?
Yes.
Okay. So go ahead and give us a background on what you deal with on a daily average.
Presently, we are at Florida Community Centers. We've been a community health center for the past greater than 40 years, right, serving the underserved community here in Fort Pierce and other areas around Florida, right, in Central Florida. I am an obstetrician gynecologist. I've been here for greater than 17 years at Florida Community Health Centers. Currently, our office and our practice have moved to more outpatient, right, where we take care of those mothers expecting babies. We also do primary care. And take care of those mothers postpartum as well. Okay. So let me ask you this. What is one area of concern that the people, let's say, doesn't take as serious as you think they need to take in the women's health department? Oh, where do I start?
I don't know. Give me something.
Okay. Well, we can talk about a couple of things. One is an initiative that I'm currently involved in with Florida Community Health Centers and the CDC, and that's to decrease the number of mothers who are dying during pregnancy and postpartum. We have a number of, most of these are the minorities who are affected most, blacks and Hispanics, right, where just because you have a healthy baby with a little high blood pressure, some of those mothers are not seeing their baby past their first year, or dying intrapartum during labor or prior to labor. And the CDC is now involved in trying to decrease those numbers right here in this zip code and other areas around Florida, and around the country. So that's one thing. We at Florida Community, we now start an initiative to follow those mothers postpartum. Well, let me start at the initiation of their pregnancy. Basically, when they come to their prenatal visits, to stress the importance of preeclampsia, and follow those mothers postpartum past 1 year. To make sure that they actually see their child's first birthday. Right. That is one thing. The other thing that kind of gets under my skin is access to prenatal care.
Yes.
You know, it really bothers me when mothers don't get prenatal care, and there's a lot of different reasons why, and access to prenatal care or health care in general is a big factor. So we are trying to improve the access to care for these patients, particularly in undeserved communities.
Right. Okay, so following up with that is, with that answer, what are some of the reasons why this initiative has been put into gear? Is it just not knowing, or not? No, I don't want to say not caring, but not taking it serious. What is your professional opinion on the reason?
It's really multifactorial. One, postpartum, the patient may come into the emergency room complaining of headaches, and the ER doctors don't ask them, hey, did you have a baby in the last year? So those mothers are lost, or they have poor follow-up postpartum,
Right.
and those mothers are suffering strokes and other hypertensive disorders where sometimes they don't make it through that ordeal.
Right.
So that's just one aspect. Another aspect is, dealing with, is this really preeclampsia? Is this really a mother who has chronic hypertension? Because there's a lot of hypertension in the communities.
Right.
And we have to really start education of these patients at their initial prenatal visit.
Right.
So it's education, it's care of the patient during the pregnancy, the hospital during the labor process also participates with the care of that patient, and postpartum even up to a year.
Right.
And involving those emergency rooms, physicians in this initiative as well.
Right.
So I know you keep saying preeclampsia. So can you kind of explain what preeclampsia is for those who don't understand what it is?
Preeclampsia is a condition in pregnancy that's common, more common in teenagers, women over the age of 35, Black, Hispanic women. There are some other ethnicities that do get it. Patients with chronic hypertension, with connective tissue disorders like lupus, and it increases their risk of developing preeclampsia. And when preeclampsia does come, they have mild preeclampsia, and they say mild without severe features, and you have preeclampsia with severe features. Severe features are patients have high blood pressure that you're giving them hypertension medications and they're not working. They complain of headaches. Sometimes they have growth retardation within their fetus. So you have all those severe features, but in which case the patient has to either be induced or delivered, because that's the key to the treatment of preeclampsia. Typically, it's delivery of the fetus.
Okay. And Rosanna, could you give us a little background on your career as well? I know that you're in the medical field, so we just want to put that out there.
So I am a registered nurse. I've been licensed since 2010. What I know about babies is from having babies.
That's good. That's great.
And understanding what preeclampsia is, because I had preeclampsia with one of my children. Because I do have a medical background, I kind of knew what I was going into and what was going on as I was having my baby and while I was pregnant. But everybody doesn't have that, and they don't have that person to kind of educate them and walk them through what pregnancy looks like and things that can happen during pregnancy and while you're in labor and postpartumly. But my background is more mental health. So I work more in chemical dependency with drug rehabs and psych. So that's my baby. I love it.
Awesome.
Okay, we all got to have a baby somewhere. So if you're in the medical field, I'm sure everyone has someone, some type of baby that they're nurturing. So that's great. I know nothing about neither of the two. So this is my baby right here sitting behind the mic. Okay, so before we continue, I want to go ahead and open up the phone lines. If we have a caller that's listening that might have a question, you can go ahead and call us at this time, at any time during this broadcast. And the area code is 772. The number is 278-8651. Again, it's 772-278-8651. If you have a question for either of our hosts on today, this is the time. Before we get off of this broadcast, is to go ahead and get your voice heard. You don't have to give your name or anything. You just need to call in and ask the doctor. That's what the show is designed to do. So we appreciate you listening, and we would like to hear from you. So go ahead and give us a call at your discretion. So the next thing that I wanted to ask is, how bad is depression during pregnancy? Does that, I want to say, have any effects on the baby?
You just hit on a very sore topic of mine. Is underreported. A lot of women, regardless of their ethnicity, do have postpartum depression with after they have the babies, and we have to be, as clinicians, and I'm not gonna just say as doctors, because everybody has to be involved. Nurses, visiting nurses, our clinics, hospitals. We have to ask those patients, hey, have you any depressed mood? Postpartum. I had a patient who I asked the question years and years ago, and I said, have you had any depressed mood? And this is 3 weeks after she had a baby, and she just broke down in tears. And so I started asking every mother after that,
Right.
Because we don't ask, we don't know.
Right.
And it's not just that 2-minute visit where they come in postpartum and we just send them home. We have to be able to look at the patient, look at their body language, and ask the question maybe not once, but twice. We do have a depression screen that we give every patient.
Right.
And that's just the initial criteria. If you fail that screen, then we go on to another screen. But we do have to ask those questions. They're so important.
Right.
So follow up with that. So with my last child, I had postpartum depression, and at first I'm like, oh, maybe because I'm feeling down because I'm used to working and being out and not being home. And at that point in time, I had became like a full-time mommy at home, and I'm like, I should be happy that I have this baby. Like, she's beautiful, she's mine. And I'm just like, I look at her, and then I'm looking at the other children, and I'm like, oh, something is off. And actually someone from your office called me because I had my last baby through your office. And they called and did a follow-up, and were asking me a number of different questions. And so that's important that someone does follow up, and people do check on those people after they have their babies, because even though it is a joyous moment, our hormones are all out of whack. We're taking care of ourselves. We're still taking care of a new life that's come into this world. And I mean, I had my last baby at 36, so it wasn't like I was a young mother or anything like that. It's like I had support. My mother was there, my husband was there, and still I just could not get myself regulated to like, okay, why am I feeling like this? And why am I not like super happy about the fact that this new life is here? And until somebody actually reaches out to you and kind of like explain things to you, like this is what's going on and this is what's happening. And those feelings, you know, are not normal. And there are things to help you get through that, because postpartum unchecked can lead to suicide and you hurting your baby. And those things are totally fixable if caught at the right time. So those conversations that are not really had at the table with people about what depression looks like, that it's not just like, oh, baby blues, you know, I'm just down right now. But if it continues on past a certain amount of time, that this is postpartum depression, and it's okay to feel that way. It's okay to express yourself and let somebody know how you're feeling, because if you're not saying, or if anyone isn't looking and asking you those key questions, then it is silenced.
Right.
I think that you touched on something very important, and that is not only the clinicians
how you're feeling, because if
asking the question, is coming to the realization that, hey, this is not normal. You know, and because you had the benefit of having other children, you know how you felt then, and that change can be stark. And I'm so glad that you realized that, hey, this is not normal, and sought help, or even admitted to the fact that, hey, I am depressed. Because it's so common today, you know.
So what about the ones that's having their first child and they don't know?
Well, that's the ones that we're trying to reach.
Right.
Because those are the ones that...
so what are some of the symptoms that they might be experiencing that they might want to, you know, consult someone at that time?
Okay. Well, you know, I'll never know what it's like to have a baby.
Right.
I'll never know what it's like to have a baby. But I can say that I know what it's like to look in a patient's eyes postpartum, even with their first or 10th child, and pick up on cues. You know, you have baby blues, and that's what you was talking about. And immediately postpartum, a lot of women, they have a change in the hormones and stuff like that, and you feel a certain way, which I can't describe. But and we know that those are typically called baby blues. But like, you know, after those baby blues are over, if you're still feeling like you can't walk outside, you feel like you have a bad body image, I don't know, you ignoring your child when your child is crying, you know, you no longer brush your hair anymore.
Right.
You go outside and you don't care how you look when you go outside.
Right.
That is something wrong, you know, and you have to investigate, hey, are you depressed?
Right. Because
again, like you said, and it's, thank God, it's rare. If you don't deal with the postpartum depression, it can go into postpartum psychosis. Psychosis is when you can hurt baby, you can hurt yourself.
Right. So we had a caller calling in, so hopefully they'll call back. And again, it doesn't have to be on this topic, actually. We're talking about this discussion, so that will fall right in line. But okay, we got him calling back. Okay, so let's go ahead and take this caller and see. WJGW, you are live, and hello.
Hello.
Okay, do you have a question on today?
Yes. What I want to ask is, can you tell us how psychological issues like depression, anxiety, how that can lead to physical issues?
So say it again. Ask the question again. I'm sorry. Did you guys hear?
Yes, I heard.
Okay.
So her question is how anxiety and depression can lead to physical issues. And with depression, there's always an element of anxiety with the diagnosis of depression. And those physical issues that you can have related to anxiety, sometimes you feel like your heart's beating out of its chest. You get those, you become fearful of things. I tell some of my patients, I describe anxiety as this: someone telling me in a closed room, hey, there's a snake in this building. Okay, I'm okay with that. But if you tell me that there's a snake in this room, now all hell breaking loose.
Right.
Because that's my anxiety. So yes, anxiety can affect basically your heart rhythm, your breathing rhythm, your thoughts, and like I said, we have to be able to recognize it. We have to trust our primary care team to address it and be able to address it and not suffer in silence.
Right. Okay. You got that, caller?
Thank you so much. That was very good.
Okay.
Thank you.
Thank you for calling. All right. So you know what? We only have like 5 minutes left.
Oh, we only have 5 minutes left.
I would like to touch on breast cancer awareness, because this is the month of October is designated Breast Cancer Awareness Month.
I know that's right.
And this is another one of my passions, because you see statistics say 1 in 8, and I tell patients that you've been in Walmart and you might have been on a line with maybe 8-9 people. You can count from the person in front of the cashier, 1, 2, 3, 4, 5, 6, 7. That person probably has breast cancer. You can go down the line. That's how common it is. And worse, when patients develop breast cancer, they never come back and say, hey, I have breast cancer. They suffer in silence, and their history is in silence and personal to them. But we need to get the word out, because some people don't come back to the doctor only if they're pregnant. After that, you don't see them no more. And when you get in your 40s, that's when the screening test begins, and patients don't come in until sometimes they might feel something that doesn't feel normal, and we send them for the mammogram, which should be starting at 40. And there's something that's been there for years, and we have to do better. We have to get the word out.
Also, if you have a family history of cancer, I think even if you have like a family history of like prostate cancer, those genes are the BRCA1 and 2 genes also correlates together with genetically. If your father has prostate cancer, then your incidences of you getting breast cancer are higher also. But even, screening starts at 40, but we're finding that people are getting breast cancer at a younger age. I just had a cousin, she's 30 years old and had to have a double mastectomy, had to have chemo, radiation. I mean, she's kicking cancers behind. But that's a young age to, as a mother of 2 and but when I tell you she's a trooper and a light to those, but it's just that you have to understand that you have to continually go to the doctor, not just when you're pregnant or when it's just time for your annual visit as a woman. You have to constantly stay on top of that. I have a story for everything. And so my story with breast cancer is when I was a youngin', I was working at Liberty, and we had this older lady. She has since passed on, and I decided that I was going to be a nurse, and I was telling her I was getting done my A&P classes and things were great. And she was like, baby? I said, yes, Miss Cynthia. She said, I've been using this deodorant, and I got this rash, and I don't know what's going on. And I said, well, Miss Cynthia, you might probably need to change your deodorant. Like, maybe that's what's the cause. And so a couple weeks go by, and she's like, baby, she's starting to have pain. And I'm like, Miss Cynthia, you probably need to go get that checked out. And so Miss Cynthia goes for a mammogram and finds out that she has breast cancer, and it's now in her lymph nodes, and she has, some removed, and then she has a mastectomy, but she later passes on from breast cancer. That goes to say that if we don't educate ourselves or reach out for information or not have programs like this that allow to get the information out, where we have access to understand that we as women or people in general just need to just keep up on our health, and understanding that it may be a rash, it may be, a knot, or it just might be warmth or swelling, and you're thinking that you might have a reaction. I feel like even though you're not quite sure, you need to go get checked out, and you may say, well, I don't have insurance, I can't do that. You have places like Florida Community Health.
Mm-hmm. That's a good one.
They listen.
Mm-hmm.
They will take you in.
Right.
If they go on a sliding scale. I've never seen them deny anybody. I've gone there myself, and no insurance, and they have taken care of me, and I don't feel like I'm a charity case. I feel like I'm a patient, and when I go places, I don't tell people what I do for a living. I'm quiet in the room because I want you to treat me like you would treat your family, because that's what we do in healthcare. That's what you should feel like you're a part of the family. Not the auntie that we don't like, but the auntie that we like. You know what I mean? Mm-hmm. So it is important. There isn't an excuse except for maybe a language barrier, but we have to be each other's advocate. We have to be that voice for each other to say, well, maybe you should probably get that looked at, or maybe you should try these services. And that's from everybody opening up their mouths. Like, there are resources in this community that can help us. There are things that, that can get you to the next step. Talking with Dr. Zollicoffer, that they service people on Avenue C at the old health department, and that's in walking distance of a lot of places. So it's not like you have to go all the way to Port St. Lucie to go see a doctor, all the way to Vero. That they have services here that are in walking distance. You have Florida Community Health on Avenue G. It's right there in the community. They have another one. Is it Delaware that they're on? That it's there. It's there. Mm-hmm. So that's just my little tidbit.
Okay.
Excellently said.
How common is it for a man to have breast cancer?
Men do get breast cancer, but the incidences of men and women are totally different, because men do also have breast tissue. I don't want to. It's not 1 in 8. It's the numbers are totally different. I don't.
How does that look? How does that feel for a man? Is it a same as a woman?
It's same, because you have breast tissue.
Yeah.
I don't got no breast.
You have breast tissue. We all have breast tissue.
Okay.
That's why men sometimes ignore the pain and think,
right.
You get it.
You get it, yes.
Yeah.
All right, Dr. Z.
All right.
You go ahead and close us out, my man. Well, first of all, I want to thank you for coming. Thank you, and Rosanna, thank you for sitting in for Mom. Again, Miss Hazel's on a mission trip, and she does many of them. She does wonderful, great things in the neighborhood, and we are thankful to have her. And again, this show is brought to get more knowledgeable on the questions that you may ask. Like Rosanna was speaking on earlier, you have all of these resources, and this show is designed to help you guys find those issues and not feel ashamed of your ethnicity and all of the things that you might wonder about. You can call in and ask us and follow up. I like that Rosanna touched on earlier, something feeling off. So if you're experiencing something and it's feeling off, you might just want to get checked out, because you never know. I do know this. I don't know a lot, but I know that the earlier we can catch something,
exactly,
the better off that we will be. So there's no need in saying, and we have done this. I've done it. Oh, I'll be all right. A headache, take an aspirin. But if it's continually, and I'm noticing it, yes, it's time to do something about that. Again, thank you, Dr. Z. So now I know I got a new name. Well, I'm gonna add my name to the list of your Dr. Z fans of that name of yours. We're gonna let you close us out on today, man. We thank you, everyone, for listening to WJGW Ask the Doctor, and we do this show every third Thursday of the month. So that's not the first, not the second, but the third Thursday in the month. We have Florida Community Health Centers. We're so glad to have them join us in bringing this show to a reality where we broadcast live, and we allow you guys a chance to call in and ask the doctor. Go ahead, Dr. Z, take us out, my man.
I think that it's important to know that we have resources here in the community. And like I said, you always feel free to reach out to Florida community. We've been here. Not like we just got here. We've been here for over 40 years, serving this area, in areas like this. We treat everybody like you're our family. You don't have to worry about the cost of things. We're not a free clinic, but we do have a sliding fee scale, where for those patients who don't have insurance, that we will see if we can do our best to try to accommodate you. And there is no place else that you can go to where they're not looking for money up front, just for you to become their patient.
Correct.
And we thank the individuals of the community who have chosen Florida community. And I would like to know and be I would like them to go out and tell others, to keep the word out. There's one last thing that I want to say with regards to, I know that we talked about women's health, but we can't stop with just women's health. We got to also touch on men's health for a second.
All right, when you ready to come back?
So we will, as part of talk about men's health in the coming weeks and months.
Right.
Talk about colon cancer and prostate cancer and things, and why men are not seeking health care.
Right.
Until it really is too late.
Yes. I look forward to that. Actually, me and Pastor Hazel have had that discussion on a couple of times. So I can count on you, Dr. Z, to come back?
You can count on me to come back. Okay,
so we'll have our men's health program segment in the near future. Again, you listen to WJGW 107.5 FM. And we thank you guys for listening. I want to encourage you to go and download our app. You can go to your Apple Store and download us at 107.5 FM WJGW, and you could take us everywhere you go. So that means, and I want to explain that app to you. So normally you get in your car, you put it on the dial, and you get to the grocery store or wherever you get to, and you get out of your car, and you don't hear it again until you get back in your car. Correct? Okay, so if you download this app on your phone, once you get out of your vehicle, you're still taking us with you. You like that, Rosanna? Like that. So we're encouraging you to download that app, and also go and check out our webpage as well. That's WJGW.com. I'm sorry, WJGW.org is the website for you guys to also go and check that out. I think you'll like that. Thank you, Louis, for a great job on the website. Okay, that's right. And we have to play our disclaimer because we don't want anyone to take us not seriously. So we're going to play our disclaimer, and we are going to be done with this segment, and we'll see you on next month. That's my birthday month, y'all. It's going to be close to my birthday around that time. So, and again, Dr. Z, thank you for coming. We like to go and tell Florida Community Health Center that we appreciate the extended hand and opportunity joining us with this show, and we are very thankful. We'll see you on the next show of Ask the Doctor.
program is not intended to replace or supplement the medical advice of your physician or clinician. This program is intended to provide general education on a variety of medical topics, but is not intended to diagnose or treat an individual's symptoms or medical conditions. Listeners or viewers of this program should seek medical attention from their personal physician or clinician for their diagnosis or treatment of any symptoms or medical conditions they may be experiencing. Neither Florida Community Health Centers, Inc., In the Image of Christ, nor this radio station warrant the currency of the information provided relative to the time of the hearing or viewing. Information and standards are continually being updated.